Okay, good afternoon to all of you. So today I'm going to give my usual talk, but we'll focus on abdominal pain, which is a very common complaint of a lot of people, right? More often than not, we get abdominal pain due to whatever cause. So before we go into the abdominal pain part, let's discuss a little bit about what TeraHertz waves is. TeraHertz frequency is between the microwave and the infrared region. So if you know physics of light, the electromagnetic spectrum, that's where it is. And the frequency is 10 trillion. This is trillion. So that's where it is. What is it used for? Mainly in telecommunication, where they are better than microwave. I'll explain what this is. And it's very ideal for detecting substances. Almost every molecule has a fingerprint in this spectrum. You know that everything has a vibration frequency, right? That's why singers can break a glass, because the frequency is the same as the glass. So this is the electromagnetic spectrum from one end to the other. These are the high frequency, this is the low frequency, which are radio waves. Okay? And the high frequency is used in X-rays, in gamma rays, and UV light. And this part is very toxic, isn't it? It can cause your cell to mutate and become cancerous. So infrared is, a lot of it is in the sunlight, as well as terahertz. This can be called near infrared. So you feel warm, you feel good. And terahertz can be called far infrared. It's between microwaves and infrared. I'll tell you a little bit more about microwave and infrared. So the breakthrough, as far as TeraHertz is concerned, came in the 1990s, when we developed ways and means of studying TeraHertz that were not available before. And it was used to look at a painting that was very old, from the 18th century. Okay? And in the past, canvas for painting were not easily available, so people tend to paint over older paintings. So when they shine on it, they can see the older painting that was there. And not only that, but they can also see the name of the artist. So now this technique is being used in archaeology, right? Sometimes, like the tomb of Qin Shi Huang in China, they dare not open up the tomb because everything may fall apart, right? So you can use this to study without breaking anything. So prior to this, people refer to the terahertz gap between X-rays and radio waves. So what is the terahertz gap? Now, we have radio around for a long time, right? In the 19th century, there were no radios. So radios, TVs and all that are in the realm of electronics. And microwave just a little bit advanced for that. Okay. Most people know microwave from the device which they use to heat food. It's able to energize the water molecule and therefore generate heat. So this is all under classic electronic theory. On this side, gamma, X-rays and visible light, we study under photonics, under light. In physics, when you study light, the section, this is where it is covered. Terror is in between. So nobody knows how to study it. That's why it's called a frequency gap. So as far as radio waves is concerned, any of you using a 5G phone? You do, right? If you're using a 5G phone, it's microwave. 4G, 3G all use radio-like waves. 5G is here. Next generation of phone, 6G, terahertz. That's why there's a lot of studies now that look at safety, because handphones have this reputation of, you use too much, you get cancer of the brain, right? So they were testing whether for 6G, whether terahertz will be safe. And it was found to be safe. So that's important insofar as being able to use this for frequency and encourage people to use it widely. So telecommunications, TeraHertz is used in 6G, military and security is able to see what normal scanning instruments used nowadays is not able to detect. Now on YouTube you see some of these videos where normal scanning devices can't pick up guns or whatever that is hid deep underneath the clothes, but TeraHertz is able to do so. And then it can also look inside plastics, textile, anything. You cover something with paper, textile, wood, TeraHertz can penetrate through. So it's used in China for drug monitoring. And it's a very elegant way of drug monitoring. What they do is they use TeraHertz to scan the plants. And they can detect how much water there is in the plant. When this water level drops, that means the drug is coming. Common sense, right? But it's very, very effective. And so therefore you can start to take steps even before the actual drop occurs. So it's used in health and science, and that's what I'm going to focus on. The Japanese have this saying that TeraHertz wave is the light of life. So it is something interesting. Now TeraHertz has healing properties. If you look at our group where people give testimonies as to what happened when they blow their skin and their medical problems with TeraHertz, sounds like miraculous healings. It is very therapeutic. So what is it that heals? Well, is it the heat? Because some far infrared or TeraHertz has a heat component. This heat effect is the same as infrared. When I was young, I was encouraged to sit early in the morning facing the sun. Early morning sun, less of the ultraviolet ray, less of the UV light, because UV light is shorter frequency. This long frequency travel further, right? So that was supposed to be healthy. And of course, you go to a fireplace, you feel good. All the infrared coming. So infrared is able to penetrate and do a lot of things. So is the ability to heal of TeraHertz come from the heat energy? Well, some scientists, they eliminate the heat energy, so you only have the frequency. And then when they do that, it was still able to produce therapeutic effects. So the therapeutic effects is more than just heat. It's a vibration itself, the frequency. Why? That's something we need to ask. Why is TeraHertz able to do that? Well, it's able to do that because the cells in your body vibrate at that frequency, at TeraHertz frequency. So, over the years, right now, if you look at the internet and look at TeraHertz and see what applications are there in medicine, there are two big groups of applications. One is diagnostic. So using TeraHertz, they can look into your body, like X-rays like that. So among some of the interesting things that can be seen, the bone, for example, TeraHertz can pick up the 3 different layers in your bone, which is quite amazing. More so, suppose in the case of cancer, because they can differentiate different layers, TeraHertz can actually mark out for you the age of the tumor, right? You can actually see where normal tissue end and cancer tissue begin. So that is very useful if you want to do any therapy. Then TeraHertz itself can be used on the therapy. That's what we all have here, all TeraHertz therapy devices. So what are the properties of TeraHertz that make it useful for healing purposes? One is low energy. It doesn't ionize any molecule. It is absorbed by polar compounds. Polar compounds are conductors of electricity. So that's why it can penetrate wood, cloth, anything. It can penetrate because they are non-conductors. But if you have water, you'll be absorbed by water because water is a conductor of electricity. That's very important. So that's why it can penetrate through all these things. That's why because it's absorbed by polar compounds, and you know different tissues in your body have different concentration of water, right? So that's why different layers in your body absorb terahertz at different rates. So that's why you can tell the different layers because of that. And the energy in terahertz is equivalent to hydrogen bonds or van der Waals forces. These are bonds that hold molecules together. They are not the same as the bonds that hold the atoms in a molecule. The atoms that hold the atoms in a molecule together are very strong forces, right? Valent bonds, right? But these are very weak bonds. These are the bonds that hold complex proteins or carbohydrates together. Proteins and carbohydrates are often folded, right, into different shapes, and these are the energy that hold it together. So by virtue of the fact that this energy is kind of affected by TeraHertz bonds, it can therefore change the shape of molecules. So I will explain to you what are the changes that you can see. And as a result, and this is also the result of the fact that human cells resonate at TeraHertz frequencies, and because of that it can regulate biological system by changing the interaction of neurotransmitters and receptors, and that's the remarkable thing. That's what scientists have discovered. So the effects of the TeraHertz radiation on the body is summarized here. It opens blood vessels, it causes water molecules to vibrate and activate, it causes the factory inside the cell is called a mitochondria. So it affects mitochondria, activate it, and you increase energy production. Hyperactive cells that are inflammatory, it normalizes it, make it normal. And then it has an effect on DNA. There's to unzip it and in a sense activate DNA. So this is the kind of system that you have in your tissues. Blood from the heart comes here, under pressure of course, because the heart pump, right? It's a blood pressure. So water, oxygen, nutrients all leave and go into the tissue, supply what you need, the oxygen, your nutrients, everything. So they go there, and as the blood goes here, the vein side very low pressure because the pressure has gone. And so here, water, excess water, carbon dioxide, waste products enter to go back to the heart to be got rid of. Now because it's a low pressure system, it doesn't quite attract all those bad things that have to be disposed of. So that's why we have lymphatic vessels, right? Lymph vessels drain all the excess water, the carbon dioxide, and all the unwanted things to bring to the heart. Okay? So basically what TeraHertz does is open up all these vessels. And so therefore when it open up, any swelling will go down. Because that's what happens when you open up all the channels. Then it regulates inflammation response. In the blood there are also inflammatory cells like this. They are commonly called white blood cells. Usually they have many lobes nucleus. So TeraHertz has the ability to tone down the inflammation by its action on certain molecules in the blood. And in activate normal cell, this is a picture of the mitochondria. This is a composite picture. It tells you the different functions that the mitochondria has. For example, it gives you energy in the form of ATP, right? It also gives you energy in the form of sugar molecules. So this is not shown here. Yeah. So, but it can produce a lot of things. All the protein input processing. It can form molecules for the cell membrane. There's signaling going on, redox process, and cells that are no longer of any use, it causes them to destroy themselves, and so forth. So a lot of functions of the mitochondria, which is the factory house of the cell, is activated by TeraHertz. It causes apoptosis of normal cells. Apoptosis is a term given to cells that has live up to its lifespan, and so has to be destroyed. So these cells, they are built-in mechanism where they break down and they release protein that say find me, eat me. So cells that are no longer useful, they automatically, you can say, commit suicide by dying. So this is how your body renews itself, you see. Parts that are old, cells that are old commit apoptosis so that new cells can come along and renew your body. The other thing is that it is able to kill bacteria, viruses, and parasites. Certainly, a lot of people with fungal infection can use this. I discovered TeraHertz because during COVID days, there was this trial done on COVID patients, and they were using blowers, blowing TeraHertz far infrared as well as near infrared, and the COVID virus got killed by them. I was interested. Hey, this is something new. And we since discovered we can do more. So, for people who have infection, this is good news. Because besides taking antibiotics, you can use this to kill. You see? It'd be very interesting if, for those cases of antibiotic resistance, this can be used. And indeed, I think we have now evolved a protocol for treating flus without the need of giving antibiotics, which may solve the problem of antibiotic resistance, right? It activates DNA. Now, this is a very interesting part. As far as cancer is concerned, let me briefly explain to you what activate DNA is all about. You know that DNA is in two strands, right? Like a zip. And when they are in the closed zip form, when the zip are closed, it is inactive. Because to be active, you need to open it up. You open up the zip of the DNA for two purposes. One, when you want to multiply. Because when you open up, you can read here, and you create another that corresponds to it. You can create another one corresponding to it, and you have a new pair of DNA. The other reason why we need to unzip is because we can read the recipe on the DNA. So you have a primase which primes it, and then you have a printer. Yeah, makes a RNA printer which read it and then print out the thing. The printer is sent into the cell. This is the nucleus, go into the cell, and then at the mitochondria, the recipe is read and the appropriate DNA, amino acid or whatever is put together and create another molecule. So the ability to do so is very amazing, and that's why some of the healing that takes place is because of mechanism like this. And certainly in cancer, in its activity against cancer cells, part of the activity arises from the fact that it can unzip and cause a chemical group called a methyl group to be attached. And that is, to me, is quite amazing. So we're talking about epigastric pain now. Epigastric pain, for ease of description, medical science has divided the abdomen into 9 parts, right? The center part is the umbilicus, the upper part is the epigastric, and this is the part that normally corresponds to stomach, liver, pancreas, and so forth. The right hypochondria means underneath the liver, the liver gallbladder. Left, you have the spleen, colon. Right lumbar, left lumbar. Hypogastric, that's where your bladder and the reproductive organs are. Right iliac, left iliac. Iliac stands for the hip bones. So right side, you have your appendix and so forth. Left side is where your colon is. So, epigastric pain, when people describe epigastric pain, I have stomach pain. It's very interesting, people use stomach pain. When you use stomach pain, the idea is, okay, my stomach is painful, but it may not be the stomach. So you got to first localize the pain. true epigastric pain is up here, above the umbilicus. But sometimes when people say they have stomach pain or abdominal pain, it could be elsewhere. We can't quite accurately pinpoint where the pain is. So for myself as well as I observe other patients, then you ask them to specify which part of the abdomen the pain is from. They have to think a bit deeper and say, okay, more to the left or more to the right. Okay? So people are often non-specific. But in order to understand correctly, doctors have to find out the onset. Is it gradual? Is it sudden? Duration? Is it intermittent? Or is it constant? The character of the pain, is it dull, ache, throbbing, sharp, piercing? Different pain characteristics are due to different causes. And then the frequency, how often does it come? Some pain goes up and come back again. Radiation, does it go from one point to the other? Associated symptoms, are there other things such as nausea, vomiting, fever, everything, weight loss, stool black in color which indicates blood, jaundice and so forth? Are there things that relieve the pain or make it worse? Is there a history of alcohol or drugs? Is there a family history of such pains? And in women, very important to take that, menstrual and contraceptive history. Very important. So what are the causes of epigastric pain? These are all the causes here. A lot of causes. Most of them of course have to do with stomach, indigestion, gastric reflux, GRD, which is reflux disease. That's you have acid going up into your esophagus and into your mouth sometimes. Heartburn, peptic ulcer. Then you have gallbladder disorder. You have esophagitis, gastritis, lactose intolerance, those Chinese who cannot tolerate milk. You have other things. Pregnancy can also give you abdominal pain, right? So one of the issues is that in a female, you ask the menstrual history and you realize that there's a menses. Pregnancy is one of the things that you got to test for. Overeating, yes, can cause stomach ache. Abdominal hernias, bladder problems, and in a female, infection. Then you have such things as diverticulitis, pancreatitis, even heart attack. When I give the lecture on the heart, I say that sometimes chest pain may be due to something in the stomach, right? Gastric can sometimes give you chest pain and your heart may be perfectly normal, and you do a scope and you find something in the stomach. The reverse is also true. We have, I have seen a widow who came because her husband just died recently. And it appears that the husband has stomach pains, so go to private hospital, seen by gastroenterologist, did a scope, found something in the stomach, so give treatment, everything, you know. Then come back with the same stomach pain again, or epigastric pain again treated more of the same. And then eventually he collapsed. And they found that he has a heart attack. But it was too late, he died. So the heart and the stomach are very related. You can have pain in one and the cause is in the other area. So this is a good example. So other causes, medication. Now this is very, very common. Medication reaction. In fact, I have seen another case which also eventually died. He was bleeding. And the cause of it, we eventually traced to the fact that he has arthritis and he was taking a lot of painkillers. Now you know painkillers you need to take with gastric pills, right? Because they cause bleeding. They cause acid production in the stomach. So he bleed because of that. So medication reaction is very important, and of course food poisoning, which is quite common, especially if you travel to other parts of the world. So these are all the causes of abdominal pain. So how do you determine the cause? You need to do tests X-rays, ultrasound, CT scans, endoscopy. Ultrasound can detect gallstone. Endoscopy, of course, can detect ulcers and things like that in the stomach, bleeding and so forth. Ultrasound also can detect liver problems and kidney stones. X-rays can detect a lot of other things, bowel obstruction. You can see the feces accumulated in your colon on X-ray. Blood tests can check for pancreatitis and infection. Urine test. The urinary system is also a common place for infection, and commonly the pain is on top here. So these are how we isolate and detect what is the cause of the pain. So these are the things that I will cover. I will cover mainly to do with the stomach, gallbladder, pancreatitis, hernias, and diverticulitis. And you have a very good idea of why you have stomach pain. Okay? So peptic ulcer is quite common. Up to 10% of people are affected, usually adults. And sores can develop on the stomach surface. Not only stomach, but duodenum, which is the first part of the intestine, and esophagus, which is the gullet. So it's associated with an infection called Helicobacter pylori. It was discovered years back that this bacteria is always present. So when they use antibiotics to kill this bacteria, it disappears. So there is a cause and effect. Must be this infection that cause your gastric ulcer, peptic ulcers, and also NSAIDs, as I said. NSAIDs is the to kill painkillers. NSAIDs that is used is very powerful, but you need to make sure that the acidity produced by NSAIDs are reduced. And of course, a lot of busy young people often skip meals, a lot of stress at work, they contribute to ulcers. A very frequent cause. For this group of people, you notice that whenever there are important things happening, like Chinese New Year or whatever, they end up with the ulcer, with an acute attack. So, what's the pain like? Burning, gnawing, associated with indigestion, heartburn. Heartburn is basically the pain. Feeling sick, and they may have a gastric reflux. That means the acidity backflow into the mouth. Diagnosis: put a gastroscope in. One of the major advances in gastroenterology is this gastroscope. The first gastroscope ever produced is a stiff one. I was then a houseman in Toa Payoh Hospital. First gastroscope. The poor patient got to turn his head backwards so that it's a straight line from the stomach all the way to your bowel. Then they put the gastroscope in. Nowadays, gastroscope is fiber optic. It can bend. So you don't have to bend your head too much. Just put it in nicely, and you can see the stomach. It's quite amazing. So you can actually see the ulcers with the naked eye through the scope. And most of the time, if it's mild, it recovers in a few weeks. In fact, if it's just one episode, it will recover within less than 2 months. So you give antibiotics because of the Helicobacter, right? And then you follow by what is known as a PPI, proton inhibitor. This commonly now is omeprazole, which prevent your cells in your stomach from producing the acid. Now, if it's chronic, it's a risk factor for cancer. If the ulcer, if the acid erode through the entire cell wall of your stomach, then you have a hole, isn't it? Then the hole will cause your contents in your stomach to empty and cause problems. So you can see here. Peptic ulcer, there are 3 types: in the duodenum, which is the small intestine, in the stomach itself, or in the esophagus. You put a scope, this is what you see. This is the ulcer, this is the ulcer. You can see. Okay. So the cause of the ulcer often due to this bacteria. Okay. So take care of outbacterial ulcers. Make sure you eat, because when it comes to meal time, your stomach produces all the acid. So you must make sure that the acid digests the food, not the acid digests the stomach. And then avoid things that stimulate your acid production, like alcohol, caffeine, coffee, and all that. Stress, not eating, lead to a lot of hyperacidity. The basic thing is avoid having an empty stomach. So, what are the complications? They recover very quickly, as I say, within 2 months. So, what do? When it doesn't recover, a few things can happen. Bleeding, a lot of blood accumulate. Perforation, the ulcer pierces through to the other side, so your contents of the stomach get emptied into your peritoneum, and it's very painful, because your peritoneal cavity is supposed to be empty. It should not have anything. But if acid goes into the stomach, of course, you will be painful. Obstruction is due to fibrosis. In other words, if you have ulcers and they heal, you have fibrous tissue. So if the fibrosis is in this area, it will cause the thing to become narrow and block the flow of stomach contents into the intestine, and therefore your stomach gets bloated. So when complications occur, the only way out is surgery. And surgery often means part of the stomach is removed. It's something like cancer. If you have cancer of the stomach, you need to remove the cancer, and part, if not the whole stomach, has to be removed. So bleeding, when it pierces through the entire wall of the stomach, the wall of the stomach is in many layers. When the acid erodes, then you need to do surgery. And in surgery, this is what happens. The ulcer and whatever tissue that are affected are removed, and then you stitch up this way, like a Y. It's called a roux on Y. So it's not fun, right, to have a stomach reduced like that. So take care of the stomach, and you won't need this operation. My dad has stomach cancer, and he passed away. But for many years before he passed away, his stomach was totally removed. So from the esophagus, it connects to the small intestines. So you have to be very careful about what you eat, right? You can't eat big amounts, you must eat small amounts. So these are some of the things that we can do. How about gastritis, esophagitis, duodenitis? I put them all together because they are the same thing, except where it happens. So all this gastritis, esophagitis, and duodenitis are inflammation of the lining, because the stomach in the center produces a lot of acid, right? So before and after can get it. If this prolonged, it can lead to ulcer, and sometimes it leads to shallow sores or erosion. One of the causes of shallow sores or erosion in the stomach is alcohol. People who drink a lot can end up with gastritis, with shallow sores and erosion. We call it gastric erosion. And because it's so widespread in the stomach, it causes a lot of bleeding. That's one of the risks of drinking too much alcohol. So, but if it's just inflammation, usually it's short duration. Unless it happens, some special cases are GERD. GERD is gastric reflux. GERD stands for gastroesophageal reflux disease. It's basically a reflux. People with GERD often sometimes wake up in the night with this gastric juice, tasting gastric juice in their mouth. And they're usually caused by infection, alcohol, tobacco, and painkillers, use of painkillers. And A psychiatric disorder called bulimia, where there's constant vomiting, can also be part of it. When you have erosion, there's bleeding, vomiting blood, black stools. Black stools are caused by digested blood, right? When you have blood in your stomach and it passes out, it will be digested by the intestines and it comes out as black. And how do you diagnose? Do a scope. So treatment is the same as pectic ulcers, small meals, well-cooked meals, avoid fatty foods, stress, alcohol, and things that stimulate acid production. Too prolonged bleeding can cause anemia. Peritonitis is when stomach contents empty into the peritoneum, and cancer. So these are the complications. So there you are. Gastritis associated with Helicobacter, with painkiller use, excessive drinking or smoking. Healthy, lovely pink color. When it's gastritis, it's a bright red color. You can see the damage there. You can see tiny ulcers, and when you have tiny ulcers, it's called erosion. So these are all the symptoms that you feel. Indigestion, nausea, vomiting, bloating, and so forth. So what you should do, fiber-rich foods, vegetables, fermented food, low sugar, low acid food, functional food. Avoid acidic food, caffeinated beverages, alcohol, carbonated drinks. They're the worst actually. Fried foods that are rich in saturated and trans fats and dairy products. These are the recommendations. Next we cover something called gastric flu or gastroenteritis or food poisoning. Very common. They are usually short-term illness triggered by infection and inflammation. Okay. And they're usually caused by viruses or bacteria. Some parasites can cause it. And you must understand that the commonest cause is something called E. coli. E. coli in different parts of the world are different. So you're used to E. coli in this country, so you travel to another place outside this country, Vietnam, Thailand, India, and so forth. It is different. So when you get infected by the E. coli, you will provoke a gastric flu. So that's why when you travel, oftentimes if you don't eat carefully, you will end up with vomiting, diarrhea, and so forth. So one way to do it is to kill all the bacteria, isn't it? Well-cooked food. Don't eat raw food. Don't take drinks with ice in it, because ice may be harboring all the bacteria. That's how you prevent this. And the symptoms usually cramps, vomiting, diarrhea, and you may have fever. You feel very weak and dehydrated. And because it's short term, it's just a few days and it's not over. Rest, plenty of fluids, replace fluid losses, sip of water. Don't take anything more complex than that. Isotonic drinks. You know what are isotonic drinks, right? 100 Plus or Gatorade or things like that. They are equivalent to in electrolyte, like your blood, like that. So if you replace all this, monitor your urine output. You want to have an adequate urine output, because if you're too dehydrated, your urine can, your kidney can pack up and stop working. So you want to make sure that there is adequate urine output, and the output should be clear and light. That means you have enough fluids in your body. If you have very little urine output, that's not a good sign. And as soon as you can tolerate the fluids that you put in, slowly ease back into eating. Start with very bland, low residue food, bananas, crackers, things like that. Antibiotics may be indicated. My very best bout of gastroenteritis was when I came back from Indonesia. So I was in Bandung attending some meetings there. And on the last day, I thought, last day here, I'm going to go home already. I have avoid all the dessert. So for that day, I think maybe I can be naughty a bit, take some dessert. And I end up with very bad gastritis, stomach flu. On the flight back, I couldn't eat anything. Whatever the air stewardess offered, I couldn't take. So I reached back home, go through this regime. So my colleague says, take this antibiotic. So I take, and eventually it subsides within 2 days. And that's what it is. No? So this thing can help in the recovery because it takes 2 days. Because it can kill the bacteria. Huh? So that's what your normal intestines look like. That's what the gastroenteritis look like. There's a lot of bacteria. Notice it's kind of raw, inflamed. So appetite loss, headache, nausea, pain, tiredness, fevers. All this can cause different viruses. Salmonella. Salmonella is a bacteria that is very common seen in infections. E. coli. The treatment: no gastric food, no dairy products, no alcohol, plenty of fluids, fruits and vegetables as you recover. It's a very simple thing, but it's something that affects a lot of people. Gallbladder disease. Gallbladder disease are common as you grow older. Female, fat, 40. Most commonly, that's what I remember from my medical school days. But it can also occur in males as well. Gallbladder is part of the digestive system that stores bile, and bile is then discharged into the intestines for the digestion of fats. What is bile? It's cholesterol, bilirubin, and bile salts. Bilirubin and bile salts are responsible for the color in your feces. The brown, yellowish color comes from bile salts and bilirubin. Conversely, if there's blockage of your gallbladder system, the bilirubin and bile salts get into your bloodstream. And then you've seen people who are yellow in color, right? Jaundice, right? That jaundice is due to bilirubin and bile salts. So in other words, it's a pigment. It's a pigment because it's broken down from hemoglobin, which is bright red in color. Okay? So these bile salts are useful because they break down fats. They are the emulsifier. Emulsify the fat and make it available for digestion and absorption. So gallbladder disease, why is it called gallbladder disease? Because it includes gallstones, cholecystitis. Cholecystitis is inflammation of the gallbladder, and then it can give rise to obstruction, where the bile cannot leave the gallbladder to enter into the intestines to digest your fats. And gallstones can be like sand, or it can be as large as a golf ball, which is what this size. So it can be quite large. So obstruction gives rise to pain, fever, nausea, vomiting, jaundice, and chill. And the pain is quite bad. You diagnose by X-rays and ultrasound. If the bile duct, common bile duct, that just before it enters the intestines is obstructed, it also causes pancreatitis because the pancreas secrete gastric juice and go into the intestines through the same duct. So that's why it's so important. And to be very honest, you can't tell the difference between gallbladder pain and stomach pain. So I thought I have gastric pain at one time. Then finally, after several episodes over a couple of years, it was so bad that I did need to go to hospital. When I go into hospital, first they did the ultrasound and said, not right, your gallbladder is enlarged. go for an X-ray, it was gallbladder. So my gallbladder was removed. So this is what it's like. And when it was removed, my gallbladder has gallstones about tiny size, maybe half the size of the small glass beads that your children play with. It looks like this. It can be quite large. So it can get obstructed. If you block here, your gallbladder gets enlarged. If you block here, your gallbladder enlarged, but you also block the bile from the bladder. So depending on how bad the blockage is, you may or may not get jaundice. So it goes down, it is joined by the pancreatic duct. So here the bile duct, common bile duct, and the pancreatic duct come together, right? So if the blockage is here, your pancreas is also affected. And in fact, gallstones is a very common cause, or one of the most common cause of pancreatitis. So what happens is very painful. So that's why that's how I ended up in hospital. How do you deal with it? As I say, fat, female, 40, fat, and all that. Sedentary, high fat, low fiber diet. So people who take a lot of fat, who love their roast pork with plenty of fat and things like that, they get it. Sudden loss of weight, diabetes, some form of edema. Complication, blockage. And blockage causes fever, jaundice, pain, and depending on where the blockage is, as I explained, once you have all these things, there's also a strong risk of gallbladder cancer. And if the pancreas is affected, there's a strong risk of pancreatic cancer, which is very rare, by the way. And the problem with pancreatic cancer is that it is deep inside, so it's very hard to detect. By the time you detect, often it's too late. So the prevention is not skipping any meal, because when you skip the meal, the gallbladder gets filled with bile, which it cannot discharge because there's no need for it to digest fats, right? If you have to reduce weight, reduce it slowly, keep healthy weight, high fiber diet. There's only one treatment needed when you have gallbladder disease: remove the gallbladder. You can live without the gallbladder. And in this sense, I suppose, it's life-saving. Because you also don't want to keep the gallbladder there. There's not only stones, but long-term, there's gallbladder cancer, see? Which is uncommon, but it does occur. So types, jaundice. There are three types of jaundice. Prehepatic, where your red blood cells are broken down, so the hemoglobin gives rise to this jaundice. Hepatic jaundice, where the cause is in the liver, cancer or whatever, they cause the bile and the bile salts to go into the bloodstream. The third type is obstructive, where there's obstruction. So because you can't flow into the intestines and discharge out of the body, it will cause you all the cancer, right? So the main thing is, when you have jaundice, discoloration, the third type, obstructive, the stool is pale in color, like clay, like that. Your urine is like coffee color. So if you pass out coffee color urine and your stool is pale, there's an obstruction. The skin is itchy because the bile salts cause you to itch. And all this can cause obstructive jaundice, pancreatic cancer, and anything connect to things, swelling of the lymph nodes near the bile duct, other pancreatic and all that, and gallstones. This is what jaundice looks like: nausea, itchiness, dark urine, diarrhea, yellow eyes, and so forth. Pancreatitis. Pancreatitis usually occur as a result of obstructive gallstone. Complications, usually the blockage, causing fever, jaundice and pain, with all the risks therein. Prevention, you don't skip meals, reduce your weight, keep healthy, high fiber diet. And how do you diagnose it? A blood test. Because when there's blockage, when there's inflamed pancreas, all the enzymes that is produced by the pancreas will be in the bloodstream. Once these enzymes are in the bloodstream, definite pancreatitis. Another cause of pancreatitis, which is not here, is alcoholism. If you drink too much excessive alcohol, it can cause pancreatitis. And you test the blood for enzymes, it's there. In the case of acute pancreatitis, the treatment is slightly different. But in the case of gallbladder disease, where it is due to the blockage that gives rise to the pancreatitis, is still remove the gallbladder. So that's what pancreatitis is. Okay. Pain of pancreatitis may be intermittent, chronic, or frequent. The pain of pancreatitis is quite unique. It can be in the center. That's why pain in the center, when it's severe, it need not be just the stomach. It could be your gallbladder. It also could be your acute pancreatitis. But eventually it will go to the side. You see? But the only way to tell is a blood test that show that there are pancreatitis enzymes, enzymes made by the pancreas in the blood. So the most common cause, gallstone. Second is alcohol. I have treated quite a few alcoholics who have pancreatitis. I treat them for alcoholism. If they're pancreatitis, a surgeon would look after that. So that's where it is. That's because the gallbladder and the pancreas are very closely linked together. So you don't want your acute pancreatitis to become chronic. Because when it becomes chronic, that means either you are a very stubborn alcoholic that refuse to give up alcohol, or the gallstones keep persisting. Acute pancreatitis, within a few weeks it disappears. But chronic, long term, keep on coming back. And all because of this. And besides alcohol, causes, if you have a family history, that's it, you will get pancreatitis. There's a record of a family history in it. And a disease called cystic fibrosis, where it affects the pancreas. And it could be an autoimmune reaction, and of course acute due to the stones and alcohol and smoking. Now when it becomes chronic, what happens? Because oftentimes it's due to a blockage, cysts form. Remember, the pancreas produces enzymes that's supposed to digest your fats, right? So if it doesn't go and digest the fats, what happens? They accumulate and they form a cyst. And in chronic pancreatitis, you see a lot of this cysts about, because the digestive juice have nowhere to go, so they swell up. So the outcome, chronic pancreatitis associated with other things, pain, diarrhea, weight loss, blockage of bile duct, permanent damage. When your pancreas is damaged, what is the pancreas famous for? Many of you know, right? Insulin, right? That's where your diabetes comes from. It produces insulin, glucagon, which is the opposite of insulin. Insulin reduces the blood sugar, glucagon increase the blood sugar, as well as digestive enzyme. So if your pancreas is affected, you end up with diabetes, and you end up with inability to digest your food. So you need to take supplements that contain digestive enzymes in order to help your food to digest. And then pseudocysts, you saw it. So surgery is needed for stones and damaged tissue. and you need to replace the insulin and your digestive enzymes that your pancreas now are not able to produce at all. And of course, there's a greater risk of pancreatic cancer, which is supposed to be rare. Hernias. This one, people complain of stomach pain. But even with those with hernias, they don't quite associate the pain with their hernia. Why? Let's try and understand. Hernias are due to weakness in the abdominal wall. Your abdomen has a layer surrounded by muscle which protect it. So when there's a weakness in the wall, intestines can protrude, can kind of come out, because when you urinate or when you defecate, you put pressure on your abdomen, isn't it? You strain and the pressure in the abdomen rises. So if there's a weakness, the pressure can push the intestines out, and that's what happens. So in a bouch, there are 4 kinds. I'll show you pictures of that. And typically, if we come out, you can feel pain or pressure or tugging sensation, depending on where it is. It tends to get worse over time with sudden pain, feeling sick and all that. Surgery eventually needed to reduce hernia. It is a mechanical fault. You know what's mechanics, right? It's physical. So weakness, something comes out, you got to put it back. It's mechanical. There's no way to relieve the pain except by reducing. So these are the allocation: upper abdomen in the midline. If you have an operation and they have an incision, if they didn't sew up, don't stitch you up properly, you can get an incisional hernia. That means the weakness, because it's not stitched properly, so the healing is not proper, intestines come out. Umbilicus, another common area. Inguinal, above this inguinal line, okay, and femoral, below the inguinal line. So these are the locations, and that's what happened. A weakness in the wall, intestine got pushed up. So sometimes the pain is here, inside. So that's why they don't connect that with the lung they feel on their body. So you can see that it can be quite bad, isn't it? So what are the complications? Okay, some of the causes. Inguinal hernia, male, overweight, constipation. When they're constipated, every time they go to the toilet, they strain themselves. Cystic fibrosis, chronic cough, premature, maybe the walls are not well formed. And in a female, of course, pregnancy. Pregnancy, the infant inside put a lot of pressure on your body. Prostate, those with prostate surgery from the top through the abdomen, and aging. Umbilical hernia, incomplete closure of abdominal walls at birth in the babies. Multiple pregnancies, then you get it. Overweight. See, overweight is one big cause of any hernia. Enlarged prostate, straining or lifting or pushing heavy objects. So anything that increases pressure inside your abdomen can give rise to hernia. Very important to remember that. So, as I said, the only way out is surgical repair. There's no other way to deal with hernias. Another thing very similar to hernias. I'm going backwards. Is diverticulosis, diverticulitis. This is inflammation of pouches formed inside your colon. Pouches are called diverticulum. And when you have a lot of diverticulum, you become diverticulosis. And when that is infected, you become diverticulitis. The last part of the word tells you what it is. So it can be acute or chronic. Acute, that means this thing develops suddenly and then subside. Chronic, heal very slowly. So it can be complicated when the diverticulum, when the pouch burst, like the ulcer we talked about just now burst and spill into the abdominal cavity, then it can cause scarring. So anybody above 40 who are overweight, smoking, physically inactive, mostly meat diet, on drugs such as steroids, opioids, and NSAIDs. Steroids are people take to suppress their inflammation. Opioids are painkillers. NSAIDs are more common type painkillers used before they graduated to opioids. So that's what diverticulitis is. It's the same as hernia. Hernia is the abdominal wall will weaken, right? And your intestines pop up, right? In the colon, inside the colon, when the stomach wall is weak, you push up. This can be empty or it can be filled with feces. When it filled with feces, then that's where it becomes infected, and that's where you have problems, right? So usually, thankfully, it occurs in this last part, the sigmoid colon, which is nearer the rectum. So with the colonoscopy, the surgeon can actually see it. So, and one way is because if it's in the colon, if there are too many of them and give you too much problems, you can actually go in and remove that section of the sigmoid colon and then stitch the two ends together. So you don't have any more problems. That is, if you are in that unfortunate situation. So it can be very bad. So what is the symptoms? This also has a sharp pain, right? Pain may be mild, fever, bloating, sometimes mistaken for another disease called ulcerative colitis. If you recover, you become normal, life expectancy, unexpected complications get infected, and it bursts out, perforation, that's when you need to do something. So when it bursts, spilling into bloodstream and everywhere, you may have bleeding, intestinal obstruction, and all the problems associated with it. So that's what diverticulitis is. Food to increase. This kind of food helps. Notice it's mostly vegetables and fruits, good oil, pineapples, blueberries, apple, oily fish, and so on. Foods to avoid: refined carbohydrates, wheat, pasta, things like that. Sugar, alcohol, spicy and rich food avoid, and red meats. So lifestyle modification is the way to go, unless you are expecting it to get worse, and the lifestyle you want to adopt. If you are told that you have diverticulitis or diverticulosis, not infected yet, high fiber diet, stop any alcohol or smoking, exercise and weight loss. Healthy lifestyle is often the best lifestyle. Prevent any illness. So that's what happened when you got to remove it. And I don't think it's worthwhile to go through such an exercise. Once you're told you have something like this, just take care. Yeah, so this is diverticulosis. All the thing comes from your feces trapped there and all the problems associated with that. Okay, I want to deal next with the urinary system. A lot of times, especially if you go to the surgical ward, many people come in and eventually diagnosed as acute appendix. And of course, the right treatment is surgery, right? Acute appendix is very sharp pain. I didn't cover it here because it's very easily diagnosed if you listen to the history and do the correct test. And one of the often important tests in acute appendix is a urine test. Why? Urinary tract infection. Mind you, acute appendicitis also starts with pain around the center. You see? But it's quite easy to pick up. Any surgical intern will learn to pick it up very fast because it's common enough. But if it's urinary tract infection, you need to treat. So, unlike peptic ulcer, which has a cause and a lot of other things, acute appendicitis, you have pain, thought to be appendix, okay, remove it and problem solved. But before you solve the problem and assume it's appendix, you have to make sure it's not a urinary tract infection because it's so similar. So, abdominal pain need not be just gastric or gallbladder or whatever. It can be this. And this makes abdominal pain so interesting because you need to sort out, and it's very common among women. 70% in their lifetime will get it, and at least 1/3 of it will be recurrent. That means you get it all the time. Usually from E. coli, which is an organism found in stool. Urine becomes dark, cloudy or red with a foul smell. You urinate very frequently, pain while you urinate. Sometimes it goes to the left of the abdomen and the lower back, the fever, all that. Older males get it. And younger males, they're usually sexually transmitted disease. Why more female gets it than male is because the female urethra is very short. The male urethra is very long. That's why males seldom get it. Oftentimes antibiotic is necessary to kill the bacteria. Sometimes we delay it because if the usual things will remove the infection, we want to hold on around. The two things you can do: drink plenty of fluids, take vitamin C, make sure that your urine becomes acidic to kill the bacteria. And you should see some improvement within 2 to 3 days. Very short-lived. So in that sense, it's easy to handle. So how do you affect your body? Nausea, pain, cloudy urine, passing less urine, very frequent urine, pain, chills, burning sensation. What is the outcome? Urinary tract. It can give rise to infection in the kidney, pyelonephritis. Or it can produce infection lower down in the bladder, cystitis, and in the urethra, urethritis. So this is a male, this is a female diagram. You can see how short the urethra is. In the female, in the male, it's such a long urethra, right? That's why females always get it. And that's why the advice for female is always wipe from back to front is not recommended because back to front you introduce the bacteria from the feces, always front backwards. So what do? For females, always make sure you clean your genitals before and after sex. Lots of water, empty bladder, wipe front to back, safe sex. Preventive strategies, front to back, drink lots of fluids, urinate frequently. We like to use center products. They can disrupt the ordinary bacteria. The ordinary bacteria in the vaginal canal as well as in the urethra protects you. But devices such as diaphragms for contraception, condoms may contain substances and things that kill your normal bacteria, which protects you and allow the growth of abnormal bacteria. So take probiotics, lactobacillus, I think this is found in Victogen and things like that. They have a lot of lactobacillus. Cranberry juice seems to help. And cranberry juice is supportive of bladder health. So these are the complications. And if it's recurrent, you may do a cystoscope to find out what is the cause. Cystoscope is when the urologist put in a tube inside your urethra and inside your bladder to see what is wrong. Okay. I thought I put in some diagrams for you to see, but never mind. We come to this last topic, urethric stones. It's not in my list, but after talking about urinary tract infection, is incomplete unless we talk about urethric stone, because one of the cause of infection that cause pain similar to acute appendicitis is stones in the urethra. Stones in the urethra are known as renal calculus, nephrolithiasis, urolithiasis. All these names don't quite matter to you. But the urethra, which connects your kidney and your bladder, there are three narrow points. Near the kidney, where it crosses, the urethra has to pass through to the pelvis. The pelvic bone is like a basin, right? And when it passes the edge of the basin, that's why it's narrow, and then as it joins the bladder. At these 3 points, if there's a stone, you will get blockage at any of these 3 points. And it's common enough. 12% in men, 7% in women. It's quite a lot. 1 in 10, or 1 in maybe 11 or 12. Risk factors: you eat a lot of meat, and a lot of salt, and you didn't drink enough water. So the pain, it tends to shoot downwards. Nausea. See, all these are very sharp pain, and that's why you complain of abdominal pain, and that's why they're all important causes. If stone is large, lithotripsy. You know what's lithotripsy? Shock wave, sound wave, high pressure sound wave, which breaks up the stone. This is standard for a lot of stones. Or otherwise, you can do stent. That means you go in, go over the stone, and then remove it. So these 3 points, these are the 3 narrowing when they cross the pelvic rim. Why stones occur? When stones occur, fever, stomach pain, vomiting, and all these sort of things. This is how a stent is done. You put it in, you go around the stone, and then pull it out. So this is a lithotripsy machine. Produce shock wave, sound wave that rupture the stones. Now, TeraHertz, we've gone through all this, and you can see for yourself that most of the time, abdominal pain are caused by a lot of causes are due to acute. In other words, they come and they go very fast. Or mechanical, like diverticulosis, or even stones is a mechanical obstruction. So, because they are short-lived, there is sometimes very little use for iTeraCare. Because iTeraCare is useful if you are in stable chronic conditions, which allows its effects to be seen. Yes, sometimes we see effect within 1 session. That is, if you have never been exposed to TeraHertz waves before, and perhaps it can go away. But you must remember that for acute conditions, it indicates that it is unstable, it changes all the time. Whether it's acute appendix or peptic ulcer, or gallbladder disease, or pancreatitis, it changes all the time. Especially for gastric flu, you need to adapt your stomach to receive food as soon as possible. Sure, if it produces longer than 2 days, it will help you to relieve the symptoms temporarily. But really, eventually, in acute conditions, you really need to resolve it rapidly so that you become normal again. So this thing is limited. Yes, you can use it, not that you can't, but you must deal with the unstable body function as a result of the condition. And where it is mechanical, such as hernias and diverticulosis, you really need to do something and ensure that that mechanical condition is no longer true. Because if there is a weakness in the wall of the intestines, well, in the abdomen for hernia and in the colon for diverticulosis, you really need to repair the wall. You cannot expect this to stay. The same for stem cells. Stem cells can repair and regenerate. And unless it can be stable, like in a case of hernia, unless you expect the hernia not to get worse, yeah, you can remodel. But I would think it is safer to go for surgical repair. Because since it's readily available and since it doesn't take a lot of time, just a few hours for the surgery to happen and get it repaired, I would think that this is more important. Similarly, stem cells and TeraHertz can give peptic ulcer disease and don't allow for complications. However, if your peptic ulcer is chronic and you need to take your omeprazole or whatever on a daily basis, then this will help in giving you complete healing. You see? So, abdominal pain, the causes of it are very varied, from things that require repair because of the weakness in the physical aspect of your walls and your colonic walls, or very acute due to gastric flu or pancreatitis due to abdominal pain or due to gallstones that can be removed. I would think that will be the more elegant solution because it's once and for all. But if your gallstones are removed and you still have the problem because of other things, yes, this can help. This is for stable chronic conditions that persist over time and you need something to relieve, then this will help. The same for stem cells. Stem cells allow whatever that is injured or damaged to repair itself and remodel itself. Like for example, a good example is the heart, which has been studied. This and stem cell can cause your damaged heart to recover completely, right? Can remodel it. TeraHertz has the ability to activate the stem cells. So it's two-pronged attack, isn't it? You take the stem cells are available to repair. You use TeraHertz, it can activate the stem cells. So it is working together in synergy to allow you to repair completely. And that's how we can then be able to live healthy lives no matter what our medical history is. Whatever your medical and surgical history, this can help. And that's how we can live a long life. So, abdominal pain, because the gut is actually outside your body. Do you realize that? Anything in your gut is outside your body. Because food from outside enter your mouth, your stomach, your intestines. They never quite enter your body. Because that cavity is a tube. The stomach, your gut is actually a tube, right? From the mouth, stomach, everything, right to the anus. So all the food that passes in, anything that you put in your mouth, is actually still outside your body, basically inside this tube. Okay? Now that tells you something. That's where your body interacts with the environment, right? In your stomach, in your intestines. Okay? And because it interacts in the environment, that's why you have so many problems. Because the environment causes a lot of changes inside your body through passing the walls of this tube inside your body. So now you understand why a lot of the things to do with abdominal pain has to do with acute, very unstable, especially food poisoning, and so forth. And unless it's chronic, as in peptic ulcer or chronic pancreatitis, really at the end of the day you need to handle it. So I hope you can use the TeraHertz wisely and use it to support your own health. With that, I would say that a balanced life depends on lifestyle choices. Being happy, maintain good habits, fresh food, pasta, pizzas are not exactly fresh food. Adequate exercise, positive outlook, lower your stress. It has been said that if you have a compassion and gratitude, it supports you. It's true. To have compassion and gratitude, you need a very positive mindset. And when you have a positive mindset, you're able to have joy, you're able to have love. And that actually supports you. And that's what it's all about. Lower your stress, spend time with loved ones, and be connected with people. And your life is meaningful if you are able to live out the purpose that you have set for yourself. So, TeraHertz is useful for inflammation, pains, blockages, and skin conditions. Very effective indeed. And that's what they are recommended for use. Not recommended for pregnancy and things like that. Acute disease, that's why abdomen, a lot of acute conditions. That's why I say not so useful. Congenital, implant objects, open wound. Open wound can be used. Open wound.